I'm Jonathan Gerwitz, Vice President of KGB Texas Communications, and welcome to this episode of thePoint. Today we're visiting with Jelynne LeBlanc Jamison. Jelynne, welcome.
Thank you.
Jelynne, you were Deputy City Manager for the City of San Antonio. You retired from being Executive Vice President at CPS Energy, and then you came back in 2017 as CEO of the Center for Health Care Services. What is it that brought you back out of retirement to go to work for the center?
Well, I quote unquote retired for a year and thought I was going to spend a lot of time with my adult daughters. And of course they are adults and working and had their own lives, and they encouraged me to either go back to work or find another group of retired friends. But the opportunity presented itself, and totally new industry for me, right. The medical industry. But I've never run away from a challenge. I enjoy a challenge, and this looked like a great fit for me.
And May is Mental Health Awareness Month.
It is, and we're hoping to promote mental wellness in Bexar County and continue to work to reduce the stigma of individuals with mental health disorders or substance use disorders, and encouraging everyone to look at it and treat it as we do any other chronic disease, that when treated, you can survive the issue and you can function to your full potential.
Let's talk about the impact of the pandemic, not only on what you've seen in the population in the community here in Bexar County, but also in how it's affected how you deliver services.
Well, we've seen a broad swath of individuals who have coping skills and operate and function at a high level, but individuals that have not fared as well through the pandemic are now being faced with loss of life and loss of jobs and uncertainty regarding their children in schools and their own employment situations. And so it has driven the number of individuals experiencing anxiety and depression much higher numbers than we've ever experienced. And these are individuals that have never experienced any type of diminished mental wellness, and so it is very new for them, and it's very difficult to navigate. So we're seeing an uptick in the number of individuals seeking services. Our existing clients, of course, the environment poses an even more difficult hurdle for them. So they were very accustomed to coming to the clinic on a scheduled basis, and when that wasn't available, given the shelter-in-place declaration for the community, we had to find ways to serve them, and we were able to do so through expanding our telehealth capabilities with them.
And the center offers these services to all residents of Bexar County at no cost or low cost?
We offer services for individuals that are uninsured at no cost. Individuals who have insurance are certainly, the services are certainly available to them as well. And then we have private pay opportunities, so we have scaled payment options for those who have an ability to pay.
And the center is part of something called the Southwest Texas Crisis Collaborative.
Yes. So Bexar County is very unique and leading the nation in this effort. So we have the South Texas Crisis Collaborative. We have 11 or 12 members, and we come together. We've created a crisis collaborative, a crisis continuum of care, so that we can navigate individuals at the right time and at the right place for the services they need when they're in crisis with a mental health issue.
And you're addressing this community, the complex care community.
Well, it's for the safety net population in Bexar County. We do have individuals with complex care needs. It's about 5,000 in our community that we see on a more frequent basis. But the overall safety net population for Bexar County exceeds 350,000 people. And to provide health care for that safety net population is almost $1.1 billion for this community.
And again, during the pandemic, have you seen that population grow over the last 15 months?
Yes. So the overall population of uninsured is now 39% or more of our safety net population. And we are seeing individuals that have never accessed these types of services before now at our doors.
Well, you talked about challenges. Late in 2020, you became the chairwoman of the Board of Trustees of San Antonio water system. Certainly a challenging time for public utilities. But let's start with talking about your vision for SAWS.
Well, the most immediate for us is, of course, recovery from our winter event. And I think the SAWS staff and the board is well positioned to look at our planning assumptions, our readiness, and for improvements in the near future to ensure that we can continue to deliver water to our customers. I can't say enough about the previous board and city council for the very tough decisions they made regarding our overall water supply for this community. We are very well situated for future water resources. Now it is up to us to continue to be good stewards and custodians and protect our water supply. Customer service and changing the landscape for customer service for SAWS will be our biggest initiative going forward. We are modernizing our meter infrastructure, and so our customers will have AMI meters in the future, and that will change how we engage and how we serve our customers in the future, and we're getting ahead of that.
I think the community hears a lot about SAWS adding water supply. What they may not be aware of is how much SAWS has done in terms of conservation. That while our population has grown tremendously over the last 2 decades, our water consumption per capita has dropped dramatically at the same time, right?
That's right. We have a tremendous conservation program, and we do so with many stakeholders that are at the table with SAWS as well. And so we lead the country in our conservation efforts, and SAWS really led the charge for us as a community to begin to think regionally and how we impact upstream and downstream of this community and how we need to plan differently.
I know, like me, you have a passion for nonprofits. You're on the board of Girl Scouts, you're on the board of United Way, Texas Public Radio, to name a few. Talk about your passion for community involvement and working with nonprofits.
Well, my mother was also very engaged in the community of Baton Rouge, Louisiana, where I grew up, and I learned from her that service is really the price we pay for the space we occupy. So I've been very blessed. I'm not a native San Antonio. This community has embraced me for over 40 years. They've allowed me to work on their behalf. When I think about the kinds of activities and projects that I've been involved in this community, it's very humbling to know that someone who's not even from here has been given the gift and given the ability to serve at the level that I've been able to serve.
Well, Jelynne, after 40 years, you're a San Antonian. Trust me, you qualify as a San Antonian. But thank you for all you've done for our community, continue to do for our community, the great work that you're doing at the Center for Healthcare Services. Thank you for being here with us today to talk about what you're doing, and thank you for joining us on The Point.